Well, Goa government has refused to take responsibility for deaths at the Goa Medical College, denying lack of oxygen as the reason behind the death of patients. The government held that deaths were because of critical condition of the patients. The Chief Minister Pramod Sawant refused to take questions on oxygen death issue during the press conference last evening. When questions were posed to him, he directed them to the Dean, Shivanand Bandekar. When more questions were asked on the death and lack of preparedness, the Chief Minister left the press conference midway. Remember, over 70 patients have lost their lives at Goa Medical College in the last few days, reportedly because of fluctuation of oxygen, putting the state government in the dock. Under fire over lack of preparedness, the Chief Minister Pramod Sawant has announced the state government will take control of admissions at private hospitals to ensure COVID patients aren't refused beds.
How many patients have died in GMC for the till date? How many patients have died in GMC because of
explain
drop in oxygen
करके
We can't put this as a direct answer, See.
I think Dean had explained. Dean ने आंसर कर दिया सब कुछ.
Absolutely defiant and not accepting the situation, in denial rather. Why then is Goa getting breathless, and what is causing so many deaths in the state's primary hospital, the Goa Medical College? There have been 75 deaths so far, and it is being alleged that the inconsistent supply of oxygen is behind the fatalities there. With the Goa government now announcing to establish 20,000 litre liquid oxygen plant at the hospital, questions are being raised if this is too little, too late. Saurav Akhtania with this ground report.
This is the Goa Medical College, which has become a hospital of horrors. Every day and every night, patients infected with COVID lose their lives due to erratic oxygen supply. This is the exact location where oxygen cylinders are loaded in trolleys and then brought to the hospital in tractors. It's alleged that tractor drivers are finding it difficult to maneuver.
These are the tractors on which the trolleys are attached, and on those trolleys, these are the oxygen cylinders. Now continuously several rounds are made through this tractors. Oxygen cylinders are brought into this Goa Medical College Hospital.
That's not all. This is your worst nightmare turning into reality. Oxygen does not even reach the COVID wards.
The oxygen pipes are several years old, and therefore the oxygen does not supply to the third and fourth floor properly, and the oxygen level several times goes down, which is when the patients die.
So how is oxygen being supplied to this hospital? First, Scoop Industries Private Limited, a private firm, is the supplier. The refilling plant of the firm is at Korlim, which is 15 kilometers away from the hospital. The oxygen is brought to the hospital in tractors and trolleys under police protection. Facing unprecedented heat from the opposition over the string of deaths, the Goa government has finally broken its silence. Goa's Health Minister Vishwajit Rane has said that 350 patients are shifted from the old GMC building to the new super speciality hospital. Earlier, the Health Minister had said that the super speciality hospital will be commissioned. He then retracted from that statement after India Today's report and now claims that it's already functional. He also assured the setting up of a 20,000 litre oxygen plant in the hospital as early as on Saturday itself.
Most important part of this tweet was Goa's Health Minister Rane is appealing to the Chief Minister Pramod Sawant to commission this block. So, even if this place is still not commissioned, 350 people, 350 COVID patients have been shifted over here. So what is the government waiting for to commission this hospital? And is there no coordination between the Health Minister and the Chief Minister?
But the opposition is unimpressed, directly blaming the chief minister for the fatalities.
If I am suppose that health minister also wants record earlier saying that the maintenance needs to be done. The maintenance is taken care by the GSIDC, which is Goa State Infrastructural Development Corporation, which is headed again by the chief minister. I don't know what is GSIDC doing.
It's taken scores of deaths for the Goa government to wake up. But even so, the situation continues to remain grim and there are no major changes on the ground as yet. With Saurabh Bhaktania in Panaji, Bureau Report, India Today.
And while India continues to battle the pandemic, these superheroes with capes have emerged as saviors of the underprivileged. A group of 50 working professionals from Delhi-NCR and other locations are providing free food, medicines, oxygen support and doctors' consultations to those in need. Here's more.
These are the superheroes of real life. Aptly calling themselves Team Avengers, this group of over 50 working professionals from Delhi-NCR and abroad are providing free food, medicines, oxygen support, doctors' consultations and counselling to COVID-affected families. They're going the extra mile to not just help COVID patients, but also the homeless amid a lockdown. These heroes are providing food packets and medical kits in and around Delhi. Abhijit Datta, one of the founding members of Team Avengers, wants the government to step up and do more for the people during this health crisis. With the phenomenal work they're doing, this superhero team has gone from 6 members to 53 members now. These volunteers are going all out. Some of them also have family members who are down with COVID, but that hasn't stopped them from continuing to choose to help complete strangers during this pandemic. Ruchi Mahajan, a life coach by profession, was distributing food packets on the streets while his son was battling COVID.
So I've decided this is the time to move out and help people because people are not getting support for basic things also from the government. Unfortunately, our country's support system is not that strong. So we decided to distribute food and then we decided to distribute medical kits.
38-year-old Roli Singh from Gorakhpur was battling the virus herself last month, and after a traumatic experience, she decided to join the cause and do her bit.
मिडिल क्लास फैमिली जिसमें हम पढ़े लिखे और हम एम्प्लॉयड लोग हैं, अगर हमें ये फैसिलिटीज़ मिलने में इतनी दिक्कतें हो रही हैं तो वो लोग जो ना तो एजुकेशन के साथ साथ ना तो वो बेसिक अपनी जो राइट्स हैं मेडिसिन की या ट्रीटमेंट की, बेड्स की, ऑक्सीजन की, ये सब चीज़ें जो खुद से अवेल नहीं कर सकते, उनको ग्राउंड पे कितना चैलेंज होता होगा. सो वी वेंट इट अहेड विद फूड डिस्ट्रीब्यूशन फैसिलिटी जो आज तक भी हम कर रहे हैं. ऐसे ही एक मेडिकल किट्स डिस्ट्रीब्यूट करने का आइडिया आया है टू द पीपल हु वर्क सो मच फॉर अस सेल्फलेसली.
This pandemic has shown us the power of the people. Citizens have come together like never before to help each other, and these people are the true superheroes of life. With Tanushree Pandey, Bureau Report, India Today.
Well, some of India's best crypto minds have come together to do their bit as India struggles to contain coronavirus. A crypto relief fund is being created to help COVID-19 patients in India, where donation is being received in different kinds of cryptocurrencies. But how does it work really, and how are they converting crypto into fiat currency for COVID relief? Chaiti Narula brings us this report.
With India grappling with COVID pandemic, what came as a surprise was a whopping $1 billion worth of meme coins donated to the crypto COVID relief fund by Vitalik Buterin, the co-founder of Ethereum, a kind of cryptocurrency.
Till now, we have deployed around $1.5 to $2 million. It's been only a few, two, three weeks that we started this campaign. So, it took us some time to kind of set up the entity, set up the bank accounts, and setting up the process flow fully. So we have already deployed $2 million, on the ground.
Cryptocurrency is always a rather tricky subject when it comes to governments across the board. A lack of central authority is usually the biggest concern why nations are usually skeptical. India is one of the countries that has always been crypto-wary. One always viewed this as a parallel world gaining prominence despite the sharp volatilities observed across different cryptocurrencies. Till date, nobody knows who the founder of Bitcoin, the first prominent cryptocurrency, is. Satoshi Nakamoto's identity is still unknown. India's tech entrepreneur Sandeep Nailwal took to Twitter to thank Vitalik Buterin for his magnanimous donation. India's Crypto COVID Relief Fund is a crypto fundraising drive accepting donations in cryptocurrencies for COVID relief in India, and this is their plan.
We have in total, before Vitalik Buterin donated us, this $1 billion in that meme Dogecoin, we had raised somewhere around, $6.5 to $7 million. Exact number is difficult to tell, but this is the notional values we can tell you that, we had around $6.57 million.
The relief fund is accepting donations in different kinds of cryptocurrencies, including Ethereum, Ripple, Litecoin, amongst many others. While many NGOs are struggling to get their accounts opened and having issues with the FCRA unable to bring in international donations, Nailwal has managed this rather expeditiously. Crypto exchanges in India like BuzzRX, CoinDCX and others have been roped in to convert the donations into fiat currency. Here is how.
We set up an entity in UAE which has a bank account. And then all the donation that comes in crypto that gets converted into stable coins, and then those stable coins are converted into fiat bank account of this entity, UAE entity. And from there, we donate these funds to FCRA approved NGOs.
A bank account with digital bank FV Bank has also been created to facilitate the transactions. While transparency, fund usage and regulatory compliance for this particular fund are at the moment the biggest concerns, Sandeep Nailwal, who is the co-founder of Polygon, has now taken on the responsibility of it. The crypto donations are trickling in at a time where India's regulator has been expressing huge amount of concerns about crypto as an asset class by itself. Having said that, India at the moment can do with all the help that is provided, and if successful, this fund could go ahead and set an example for the times to come. In New Delhi, Chaiti Narula for India Today.
It brings us to the end of this edition. For all news and updates, you can log on to our website, that's indiatoday.in. You can also download